number you have dialed is either unattended or out of
I don't want to remember. They say I'm wasting my life, secluding myself up in my room, freeloading at my sister's house, doing nothing but paint portraits that won't sell. But they know nothing. All I want is escape from this reality, from myself, and what has haunted me for the past 31 years.
Miss Diaz, your daughter's body was found dead. I'm sorry.
In other news, around 4:30 this morning, the body of a young girl was found at the corner of 5th and 6th Avenue. Reports showed signs that
Richard,
before the
I'm
victim
talking to you.
of severe blunt force trauma.
My daughter is dead, and you're acting like nothing's happened.
She was drugged and then
As I was saying, Mr. Tan, can you recount the events of the last time that you have seen your niece,
was only
Juliet?
13 years old.
Yeah, it was 4 days ago. We were making her art assignment living room. She seemed fine, happy even. When it was getting late, I told her to take some rest, and I would finish her assignment by the morning. And the next day, she was gone.
Is that all, sir? Do you remember anything else?
Mail. Thanks, cutie.
No.
For further information regarding the case, we have our news reporter, Sam.
Yes, Lucy. We have with us Police Chief Emily Kohlberg. Ma'am, what can you say about the similarities between Jane Doe's case and the recent serial murders? Has the criminal taken a liking to the rape as well?
It's actually too early to, without the further information needed, it's actually too early to conclude anything really. But with the method of killings that we have observed, there is such a resemblance that is almost impossible to ignore. We at the precinct are actually already concluding that the rape killer might also be the criminal that is involved in Jane Doe's case.
And you two are?
Don't waste our goddamn time. Let me see her.
Richard, what are you trying to do? We just want to know where my daughter is. I know you've been through a hard time, losing a loved one and all, but please calm down. Don't worry, I'll take you to her personally. We have arrived, caliber number 0261, Diaz Juliet T, age 13.
What happened exactly?
The laceration of her jugular was not the cause of death. As you can see, your niece suffered from severe blunt force trauma to the side of her head, causing subarachnoid hemorrhage inside her cranium, which ultimately resulted to her death. Contusions were found on her wrists, and her scalp appears to have been forcefully uprooted along with her hair. This might be a bit sensitive. Are you sure you want to know more? We can leave things here for today if you want.
Keep talking.
As you know already, Juliet was raped. Faint traces of Villaflor were found in her system, which means she was drugged before the rape took place. Her genitalia, specifically the cervix, is swollen and inflamed. Signs of tear and coerced entry are evident as well, apparent with evidence of her ripped hymen.
Speak English.
What I'm trying to say is that Miss Diaz here was drugged and forcefully raped in a violent fashion. Now, if you will, I have work to do. I'll give you a few minutes to grieve.
Don't worry. I'll find Juliet's killer. I'll make him pay. Please, detective, let me help you!
Forget it, Mr. Tan.
Please, detective, I don't want to bother you. Detective!
Hey! Hey! Detective! Let me help you! Let me help you! Wait!
What do you think you're doing? You want me to run you over?
Please, detective, I know you have all the info on Juliet's case. I don't want to let her down.
Look, Mr. Tan, if you really want to help your niece, go out there and comfort your sister. She needs you now more than ever. Now please,
Move aside.
Richard, I just lost my only daughter, and I have a lot of problems. I don't have time for you to act like this. I'm sending you to a doctor.
Mr. Tan, so according to your sister's statement, you've been undergoing a state of physical unrest.
Well, yeah, you're right, but honestly, I'm fine.
Look, Richard, you're a grown man. I know when stress gets to you, you break down, and so do your neurotransmitters, especially your norepinephrine and serotonin levels. But according to your test results, it seems to me that you're not afflicted with anything physical. I have decided to refer you to a clinical psychologist, a friend of mine.
Sure. And the next day, I was a wreck. I tried calling her phone, and it just kept ringing and ringing. If I had to hear the service provider again, it'll be too soon. And my sister wouldn't even look at me.
And you believe your sister is doing all this to keep you away from home? You're saying that she can't stand looking at you because she blames you?
It was my fault. It was my fault. I was supposed to take care of her, while Carla, my sister, was away at work. I didn't even hear her get taken away. I should have been there for her. I should have been there for her. You know? I should have protected her.
Richard, your grief is clouding your judgment. Your sister wouldn't take care of you this much as a form of punishment. She wants you to get better. She needs you.
Maybe she was right. She's always been right. I'm useless. I'm useless.
Just let it out. Let it out.
It's just hard. I'm an adult living in my sister's house. I dropped out of college. I got fired from my job. And I can't focus on anything long enough. I keep hurting everyone around me. I don't know why I'm like this. Okay? I don't know. I don't know. I feel like there's been a weight ever since I was a kid. A weight on my shoulders. Living under Carla's shadow. It happened though. It happened. I became the disappointment that everyone expected me to be. I'm fine.
Okay, I'll be there whenever you're ready. Richard, maybe you could use an outlet for your frustrations. I understand that you know how to draw and paint, right? Maybe draw a couple of portraits to help you relax. Take a breather. Don't worry, the detectives will find your niece's killer.
You have mail, miss.
Either unattended.
Thanks, cutie. I'll see you tomorrow.
Juliet! 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 Who killed you, Juliet? Who killed you? Who killed you? Who killed you?
Stop shouting, Richard 10.
Whining like a girl must bring her back from the dead. Who are you?
I killed her.
I killed her.
Stop messing with my head! Who did it?
Maybe I did it. Or maybe he did it. Or maybe you did it.
Or maybe we killed her together. How would we know?
Stay back! Stay back!
Sorry, Juliet. I'm sorry.
What happened to him, doctor?
From what I got from him, I believe your patient has dissociative identity disorder. He created two alters, one a sociopath and the other a pedophile, and he blacks out whenever they come up to the surface.
Multiple personalities. That explains his anxiety and depression. It wasn't normal. I should have realized that when I first talked to him. I'm sorry, doctor.
Don't blame yourself, Dr. Montfort. The symptoms for DID are very vague. Even the self-persecution and violent bursts could have been confused for grief. It would have gone unnoticed for years if he hadn't turned himself in.
Has anyone contacted his sister?
We tried their house phone, but it was unattended.
I keep a close watch on this heart of mine. I keep my eyes wide open all the time. I keep the ends out for the tie that binds. Because you're mine.